My name is Timothy Walker, and I am pleased to be your MC for this Newsmaker Breakfast event. We're going to learn this morning about an important link, and I salute you all for being here because you are standing up for mental health in our community, and it's such an important thing. I'm sure you've all been hearing in the news lately across the provinces, people doing other things. Federally, we're talking about it all week long. We're talking about the health of people in the workplace, so certainly this is a well-timed event. Now, for tweeting, it's an important housekeeping thing. One of our partners, Eric, is over there tweeting frantically because we want to send the message far and wide about what we're doing here today. The hashtag is MHPartners, Mental Health Partners. We will not be offended if you are looking down at your devices through this event. And of course, we're talking about Health Partners here today, which is Give at Work, which is their tag. And we can begin our program. Everybody comfortable? There are a few more seats over here for anybody at the back. So the person who has kindly agreed to offer welcoming remarks really doesn't need any introduction, as he's well known in Ottawa and beyond. It's my pleasure to ask Mr. George Weber, President and CEO of where you are today, the Royal Ottawa Healthcare Group, to please come to the podium and offer words of welcome to this great group of guests.
Thank you very much, Timothy. Pleasure to see you again, and thank you for emceeing this event. Bonjour, mesdames, messieurs, bienvenue au Royal. Welcome to the Royal and to the Royal's Winter Garden. I think it's very much a great place to hold these press conferences and the launches of various announcements, which we do all the time. So thank you for joining us this morning. As an academic health science center specializing in mental health and addictions, we believe it's only fitting that you chose to launch the HealthPartners Chronic Disease and Mental Health Report here in the Royal. And as an aside, I just come back from Prince Edward Island where there was the National Health Leaders Conference, and Healthcare Can with Ipso Reid just did a polling of Canadians, 1,230 Canadians in May. And as Bill Fole, the CEO, would say, it's his worry report. This is the Canadian worry report on the future of healthcare in Canada. And some of the questions, the main question that was asked, what are Canadians worried about? And it said, if 70% are worried about falling through the cracks, where are the fault lines? And the number one fault line, 91% of Canadians polled want more done to improve the quality and accessibility of mental health care. So you're right in line in terms of a great time launching this report, aligned with this latest poll that came out, that was issued, as a matter of fact, on Monday morning. So the timing couldn't be better. The brain is the most complex and least understood organ. And at the Royal, we know that when your physical health is at risk, so is your mental health. Much of our research here at the Royal focuses on the mind and body connections. Mental health is also a chronic disease, and we know that mental health and addictions is a burden that is more than 1.5 times that of all cancers and more than 7 times that of all infectious diseases. Millions of Canadians benefit as a result of your collective work and dedication to enhancing the quality of life for those living with chronic illness. We are impressed by the number of programs, services, research projects that you support to meet the needs of children, teenagers, adults, and the elderly. Nor do you forget the caregivers of the chronically ill, who often carry a heavy burden of responsibility and resulting stress. I heartily applaud HealthPartners' inclusion of support for psychological well-being in the programs they provide, and their focus on mental health in the workplace. The fact is, every day across Canada, workplaces of all kinds are suffering losses in productivity due to employees' undiagnosed or untreated mental illnesses and level of stress. As a matter of fact, there's over 500,000 Canadians daily that are out of work because of a mental illness. That's a big number when you add it all up in terms of the cost to them, their families, and to the workplace. This is a tremendous waste for the quality of life of the affected employees, their co-workers and family members, and of course their employers. Enhancing our understanding of the mind-body connection is something we can all work together. And now it gives me great pleasure to introduce Ms. Eileen Dooley, CEO of HealthPartners. Eileen, please.
Thank you, George, and thank you, Timothy. It really is a pleasure for us to be here this morning. And George, I just want to thank you for being here. He actually reorganized his schedule so he could come and give us some welcoming remarks, but also because of the tremendous leadership that the Royal Ottawa provides in the area of mental health. I'm sure that most people in the room are aware of the fact that this is an institution that is doing groundbreaking work, that is having a positive impact on the lives of people here in our community and in every community across the country. So, Georgia, thank you for your leadership and for all the work that the Royal does. C'est un grand plaisir d'être ici aujourd'hui et bienvenue à tous. It really is an enormous pleasure to welcome you to HealthPartners' first Newsmakers Breakfast. And I'd like to start with a question, and forgive me those of you that have heard me ask you this question before. How many of you know somebody who has been touched by cancer, has had a stroke or heart disease, arthritis, Alzheimer's, cystic fibrosis? Is there anyone here whose hand hasn't gone up at least once? No, not once. Ours is a collaboration of 16 national health charities, and what we do is connect our charities to employees and workplaces to try and make a difference in the lives of Canadians here in this community and in every single community across the country. What you've shown through raising your hands is a central fact for those of us at HealthPartners, and we see this every day. We know that over the course of their lifetime, 87% of Canadians are likely to be directly affected by one or more chronic physical disease. And you heard George talk about mental illness. When you aggregate that all together, it touches the lives of each and every person here and in every community and in every workplace across the country. Every day, our 16 health charity members provide a range of inspiring, sensitive, highly effective services and programs to enable Canadians with chronic diseases to enjoy the very best lives that they can. Essentially, as I mentioned, we act as a catalyst by connecting employees to Canada's most trusted and most respected health charities. Collectively, through workplace giving and engagement programs, we help to build healthy workers, workplaces, and communities. We provide programs and services to Canadians living with chronic disease and major illness, and we find cures and treatments for those diseases through life-saving research. And I have to mention, at the back of the room, we have our living proof materials. And I want to tell you that the living proof is a result of the investments that donors have made that have in turn been invested in research, in frontline programs and services, and in health prevention and promotion activities. And so we applaud those of you who are here today who are some of our living proof ambassadors, and thank you for all the work that you do to work with us. This morning, we're launching our Chronic Disease and Mental Health Report with findings that may surprise and perhaps even shock you. This report highlights a startling link between chronic illness and our mental well-being, and it shows clearly how our member charities programs can be literally life-saving in terms of both body and mind. I'll be expanding on these points in a minute or two, but first I'd like to focus on why we chose to release this report during National Public Service Week. À Partenaires Santé, nous avons voulu profiter de cette semaine particulière pour saluer le travail et le dévouement des fonctionnaires de la région, de la capitale et de tout le pays. Chaque jour, ce sont eux qui répondent aux besoins des Canadiens et aident à maintenir le Canada parmi les pays le plus en vie du monde. Ils le font en mettant à profit une inventaire
incomparable, je m'excuse, de talent et d'expertise en maintien des idéaux et un engagement exceptionnel. I have to tell you that we are always touched and impressed with the generosity of federal public servants. Since HealthPartners has been in partnership and working to raise money in the federal government employee campaign, federal government employees have contributed more than $135 million for our member charities. And so you have, for those of you that are federal public servants, you have touched the lives profoundly of people here in our community and in others across the country, both through the work you do every day, but through your incredible generosity in the campaign. Another reason for releasing our report now is because it sheds new light on the ever more pressing issue of mental health in the workplace. This is an issue HealthPartners members take very seriously indeed and respond to with special services. The report we're launching today explains why and how HealthPartners' 16 member charities support psychological well-being as a crucial component in fighting chronic illness. It demonstrates through the often alarming statistics I mentioned earlier that Canadians suffering from chronic disease or major illness are more prone to mental illness than the general population. And George talked about the mind-body link. It is so close that in some cases we can even think of mental illness as a side effect of chronic disease. Il suffit de penser à deux des chiffres cités dans le rapport. On estime que 25% à 50% des personnes atteintes d'une maladie chronique connaîtront aussi la dépression. 25 to 50% of people with a chronic disease also suffer from depression. Parmi tous les Canadiens qui reçoivent un diagnostic de cancer, 42% font une dépression. 42% of Canadians diagnosed with cancer also experience depression. That mind-body link is so clear. While the body affects the mind in this dramatic way, the reverse also holds true. Our report explains that mental illness can cause changes that make the physical symptoms of a disease worse or undermine the all-important disciplines of a person's self-care. And we provide plenty of substantiating evidence. You'll learn, for example, that the risk of mortality increases by 30% when people with diabetes also have depression. And that people who survive heart attacks but suffer from major depression have a 3 to 4 times higher risk of dying within 6 months than heart attack survivors who are not depressed. The figures contained in our report underline just how critical it is that people with chronic diseases look after their mental health as well. And HealthPartners' 16 members charities are there to help them do just that through programs offering peer-to-peer lifelines and a host of other supports. As the report details, these include programs for caregivers who can also experience severe depression as a result of their onerous ongoing caregiving responsibilities. And it's estimated that 20% of caregivers also suffer from depression because of the responsibilities of looking after a loved one with a chronic disease. I want to return now to that pressing matter of mental illness in the workplace. Some of you may already be familiar with this staggering statistic, and George referenced it in his notes. Every day, 500,000 Canadians, 500,000 working people in this country, every single day, are sick. They call in into their workplace because of depression. And according to Statistics Canada, it is employees who have both a mental and a physical illness who stay off work the longest. You'll find lots of other illuminating statistics and facts about this issue in our report. This crisis of absenteeism due to mental illness issues, and it really is a crisis, costs our national economy more than $51 billion a year. And that's just mental health. We know that productivity lost from physical chronic disease is about $60 billion a year. So you add that up, the cost to us as employees, as consumers, as employers is profound. It's no wonder the Conference Board of Canada devotes an entire symposium to workplace wellness and mental health each year, examining this ever-growing concern in detail. And it's no surprise that in her March 31st, 2015 report, Janice Charette, the Clerk of the Privy Council and Secretary to the Cabinet, made mental health one of her top 3 priorities for the Federal Public Service. Because they recognize mental illness in the workplace as one of the most urgent issues of our time, HealthPartners members have put in place supports specifically designed to help people experiencing both physical and mental illness continue in their jobs or make a smooth transition back to the workplace, provided their chronic disease or their major illness permits that. The mind-body connection between chronic disease and mental illness, it's real, it's serious. And the consequences, if there is no intervention to combat issues like depression, cannot be ignored. Through our chronic disease and mental health report, HealthPartners not only highlights the existence of this connection, we've laid out exactly how our organization, working with our 16 national partners, and we are so proud to work with them, can help all Canadians who are struggling to cope with both physical and mental illness. Il faut aider l'esprit à aider le corps pour que les Canadiens puissent réaliser leur potentiel à la maison, au travail et dans leur collectivité. Canadians like your family member or neighbor or work colleague, your son, your daughter, a loved one in your life. When you put a face to the statistic that 1 in 4 Canadians will experience a mental illness in their lifetime, this statistic becomes real. It's no longer a faceless number. Imagine that person you know dealing with the dual-edged sword of a chronic disease and a major illness, plus a mental health issue. We all have a part to play in helping the person we know who is living with this dual-edged sword. We can do this by listening sympathetically, by offering words of encouragement, by volunteering with a health charity, or by donating to HealthPartners. It really is up to each and every one of us to reach out and make a difference, to help in our own way someone we know who is facing the enormous challenges that mental illness and physical illness impose. When you hear Myra Conway's story, you'll see very clearly how the right kind of support can restore pure joy to someone whose world has been devastated by disease. Thank you for considering all the ways you can make this happen in someone's life. Thank you so much for being here this morning. We are so proud to be able to release this report and share some of the amazing work that is done by our 16 partner charities. Thank you so much. Merci beaucoup.
Thank you. First of all, I have to tell you this is old homework for me because I used to work here at the Royal Ottawa, but it looked very different in the days when I worked here. So I'm not sure that I feel that I'm coming home because it is so different. But that's what happens when you leave a place for a while. It grows up around you. So thank you very much for listening to my story. As my husband and I were getting older, I can remember thinking, the worst thing that could happen ever to me would be for one of us to get Alzheimer's. Then, when Michael was 57, he was diagnosed with frontal temporal dementia, which is related to Alzheimer's disease. I was devastated. But not Michael, he wasn't at all, because the disease impaired his judgment. He had no idea there was anything wrong with him. My husband was a Canadian diplomat. During our marriage, we had lived in some of the most difficult parts of the world. We had always shared everything, the good and the bad. But this was a different kind of bad. Michael just couldn't comprehend this illness. Here we were, facing the biggest challenge of our lives, a disease that was going to end our life as a couple. And for this last adventure, I was completely on my own. Attending an information session on Alzheimer's disease only increased my feelings of isolation. The people at the meeting who were my age, people in their 40s, had parents with dementia. And the people who had a spouse with the disease were my parents' age. I felt totally alone in the world. It was the worst time of my life. But then the Alzheimer's Society threw me a lifeline. I received a phone call from the local chapter inviting me to join a support group for the partners of people who had early onset dementia, the kind that Michael had. And there I found a home. For 5 years, I cleared my schedule one Wednesday afternoon every month to attend the meetings. I was holding down a demanding, high-level government job, but those afternoons were sacred. It didn't matter who wanted to see me. Those afternoons off were essential. I couldn't have made it without that group. We shared our experiences and our ideas. We laughed together, we cried together, and we weren't alone. My friends, my family, my faith, and my colleagues, my public service colleagues, helped to keep me strong. And I was very lucky. Michael was a wonderful person, and he never stopped being a wonderful person. As things were stripped away from him, his innate goodness shone through. But without the support of the Alzheimer's Society, I could not have continued to function. Michael was ill for 5 years, and although he remained gentle and lovely, he was constantly changing. I was able to go to the Society for information about community resources when I had nowhere else to turn. I have a background in psychiatric nursing. As I said, I used to work here, and I know the emotional and physical experiences of providing care for a loved one with a chronic illness exact a heavy toll. Huge. I know that the prevalence of depression among those caring for a spouse with dementia is shockingly high. And yet, I did not become depressed. I should have, but I'm a naturally joyful person, and I continue to be joyful throughout Michael's illness because I had a place where I could go for help and to be understood. The tremendous support of the Society and the group allowed me to stay strong, so I could focus on Michael and make his life as enjoyable as possible. I know there are others who walk in my shoes and who deal with depression and isolation and loneliness. I feel for them. I realize now that getting Alzheimer's was not the worst thing that could have happened to Michael. My husband died when he was 62 years old, and I knew I had to give back to the organizations that had helped us to make the most of our last journey together. And I have tried to give back a lot, not because I'm a wonderful person like Michael, but because volunteering for the Alzheimer's Society and for HealthPartners has allowed me to turn his illness into an ongoing gift. If Michael had died and that was the end of it, it would have just been a tragic chapter in our lives. Instead, I've been able to carry on his legacy. By talking publicly to people like you, I am able to keep our story alive while bringing hope to the lives of others. And perhaps in a small way, I'm helping others face similar challenges, who may be struggling as well with loneliness, isolation, and depression. I know I've said that before, but those are such important words. I am living proof that HealthPartners works. There we were, Michael and I, just enjoying our time together, when all of a sudden, a life-altering diagnosis came at us out of the blue. And amazingly, there was an organization there to help. We had no idea that we would ever need it, but there it was, and it was wonderful. But organizations like the Alzheimer's Society don't just happen. They happen because people donate so much of themselves, their time, and their money to be there when people need them. At some point, we are all going to need one of these organizations, and we have to make sure that amazingly, just like for us, they are there for each and every one of you. Thank you for listening to me.
I really do want to reiterate what I said earlier. We are so humbled and inspired by the fact that you would join us today to hear about the incredible work that our 16 partners are doing. And you've heard Mara's story. I mean, honestly, there are stories from thousands of people here in our community and thousands of people in every community across the country who can attest to the fact that your contributions, whether it's your time, your support, your words of encouragement, your money, have helped them regain their sense of control over their lives, that help them get through the chronic disease that they're experiencing and the concurrent pain of a mental illness. And so I really want to thank you for the work that you do every single day in your own communities to help individuals have chronic disease or mental illness, and for the work that you do to support us to try and broaden our reach and touch as many lives of Canadians as we possibly can in a very positive way. Thank you, Timothy, for your lovely emceeing this morning. Again, I want to thank George and the Royal. It really is such a tremendous pleasure to be here in such an institution to do this. And thanks to all of you, to our ambassadors who so generously give of yourselves, to our federal public service friends who every year just inspire us and humble us as you reach into your pockets and dig deeper to support those causes that are so important, to our charity staff who are here, and to our private sector partners. We are so pleased that we can work together to try and build a healthier community and healthier workplaces all across this country. Merci beaucoup. Thank you very much.